If you're over 60, this one vitamin, the very one you might be taking every day, could quietly be raising your stroke risk. Not in months, not in years, but overnight. No pain, no warning. You go to sleep thinking you're protecting your health, and wake up slurring your words or unable to lift an arm. As a neurologist who has spent over 2 decades working with older adults, I've seen this happen far too often. And not because of junk food or smoking, but because of something most seniors think is helping: a simple supplement. Yes, I'm talking about vitamins. Millions of older adults take vitamins to boost energy, sharpen memory, or keep their bones strong. But what they don't realize is that when taken the wrong way or in the wrong amount, some vitamins can actually harm the brain, and in some cases trigger strokes, bleeding, or permanent damage overnight. Today, I want to share 5 common vitamins that every senior should be cautious about. These aren't rare or exotic. You've likely seen them in your medicine cabinet, maybe even took one this morning. So if brain health matters to you or to someone you love, stay with me. This could be one of the most important conversations of your life. Subscribe before starting this video. Our channel, Feel Fresh 360, to get more informative videos about healthcare. Number 1. Vitamin D, the silent stroke trigger. Let's start with one of the most popular supplements out there, vitamin D. You've probably heard it's great for bones, mood, and immunity. And it is, when taken correctly. But here's something you likely haven't heard from your pharmacist. Too much vitamin D, especially at night, can quietly increase your risk of stroke. Let me tell you about a patient of mine, Walter, a 74-year-old retired military officer. A disciplined man. He took care of his health, ate well, exercised, and never missed his morning routine. Included in that routine was a 10,000 IU vitamin D capsule, over the counter. He believed he was doing everything right. But one morning, his wife found him sitting on the edge of the bed, confused and unable to move his right arm. He tried to speak, but only mumbled sounds came out. He had suffered a stroke in his sleep. Tests later revealed dangerously high levels of calcium in his blood, a result of vitamin D toxicity. You see, high doses of vitamin D cause calcium to flood your bloodstream. That calcium can stiffen arteries, increase blood pressure, and reduce blood flow to your brain. Add poor sleep or mild dehydration, both common in seniors, and the stage is set for a stroke. The scary part? There are no symptoms of vitamin D overload until it's too late. So here's what I want you to check right now. Is your vitamin D supplement more than 2,000 IU? Are you taking it with calcium or heart medication? If yes, it's time to reevaluate. Always take vitamin D in the morning, with food, and only after checking your blood levels. Remember, more is not always better. Number 2. Vitamin E. Brain bleeds and blood thinners. Next up is vitamin E, often promoted as the heart helper. It's true that vitamin E has antioxidant properties. But did you know that in high doses, especially when taken with blood thinners like aspirin, warfarin, or Plavix, it can drastically increase your risk of brain bleeding? One of my most heartbreaking cases was Evelyn, an 81-year-old retired librarian. She was witty, bright, and always reading. She also had a heart valve issue and was on blood thinners. One day, she saw an ad in a magazine for natural vitamin E for memory and circulation. She added it to her routine. 3 weeks later, she collapsed at home with a terrible headache and slurred speech. CT scans revealed a hemorrhagic stroke, a bleed inside her brain. Why? Her blood had become too thin. The combination of warfarin and high-dose vitamin E, 800 IU, made it nearly impossible for her blood to clot. The recommended daily dose of vitamin E for older adults is just 22 IU, but most supplements on the shelves, 200, 400, even 1000 IU per capsule. That's not just excessive, it's dangerous, especially if you're already taking blood thinners. So here's my advice. If you're over 60 and on heart meds, talk to your doctor before taking any vitamin E supplement, and always check the dosage. Number 3. Vitamin B6, the nerve destroyer. Now let's talk about vitamin B6, often advertised as a brain booster or nerve support. You'll see it in memory formulas, energy drinks, even multivitamins. But what most seniors don't know is this. Too much B6 can actually damage your nerves, sometimes permanently. I remember Harold, 76 years old, retired trucker. He came to my office because his feet were numb, his hands tingled, and his balance was off. He thought it was just old age. But when I checked his supplements, I found the real issue. He had been taking 200 milligrams of vitamin B6 daily, more than 10 times the safe limit, for over a year. And the result? Peripheral neuropathy. His nerves were essentially being poisoned by the very vitamin that was supposed to protect them. Here's the catch. B6 builds up over time. It doesn't flush out like vitamin C. And in older adults, this buildup can strip away the protective coating of your nerves, like peeling insulation from a wire. Symptoms include numbness, tingling, tremors, confusion, even difficulty walking. Many seniors mistake it for arthritis, dementia, or just aging, but it could be B6 toxicity. Stick to the safe range, 2 to 10 milligrams daily, including what you get from food. If your supplement has more than 50 milligrams of B6, throw it out, or talk to your doctor. It's not worth the risk.
Number 4. Vitamin A, vision or brain pressure. Vitamin A, often taken for eyesight, skin, and immune health. Sounds harmless, right? Well, too much vitamin A doesn't just sit in your body. It stores in your liver and brain. And over time, it can cause something called pseudotumor cerebri, a condition that mimics a brain tumor. One of my patients, Dorothy, 79, retired piano teacher, came in with headaches, blurred vision, and nausea. Her family thought it was a stroke, but scans showed no clot, no bleed. Instead, she had increased intracranial pressure. We traced it back to a high-dose supplement she'd taken for years, 10,000 IU of vitamin A daily. The safe limit for older adults is about 2,500 to 3,000 IU, and even that should be under medical supervision. Many multivitamins already meet that daily need, but when you add eye formulas or anti-aging blends on top, you could be doubling or tripling your intake without realizing it. Number 5. Niacin, the cholesterol cure that spikes blood pressure. Finally, let's talk about niacin, also known as vitamin B3. Many seniors take niacin to manage cholesterol or improve circulation. It's even prescribed by some doctors in high doses. But here's what often gets overlooked. Niacin can cause unpredictable swings in blood pressure, especially in older adults. Frank, 82, retired postman, started experiencing facial flushing, chest pounding, and dizziness in the morning. His family thought it was anxiety, but when I checked his supplements, I saw the real cause. He was taking 2,000 milligrams of niacin daily from a cholesterol support blend, over 60 times the amount his body actually needed. Niacin causes your blood vessels to dilate, expand, and then constrict. This yo-yo effect can spike blood pressure, stress your heart, and reduce blood flow to the brain. The perfect storm for a stroke or mini-stroke. Frank had a TIA, a transient ischemic attack, a warning stroke. So what should you do instead? Now going to talk about solution. By now, you might be asking, Doctor, what should I do instead? If these vitamins are risky, how do I protect my brain? The answer is simple, but powerful. Real food. Your body wasn't designed for mega doses of synthetic pills. It was built to thrive on whole, natural foods, rich in nutrients in their most usable form. Let me tell you about Margaret, a 73-year-old retired school principal. She came in with dizziness, fatigue, and rising blood pressure, despite taking a drawer full of supplements. We cleared her cabinet, one by one, and replaced it with simple, brain-friendly foods. Her breakfast? 1 boiled egg, protein, half avocado, healthy fat, 1 slice of whole grain toast, fiber and energy, handful of blueberries, antioxidants, a glass of water. No pills, no powders, just food. Within weeks, her symptoms faded. Her mind felt clearer. Her balance improved. She didn't need 10 vitamins, she needed. So here's your simple takeaway. Before reaching for a supplement, ask, can I get this from food? Because some of the best brain protective foods are already in your kitchen. Leafy greens like spinach and kale, fatty fish like salmon or sardines, berries, nuts, seeds, olive oil, whole grains like oats and quinoa, water, lots of it. Your brain loves hydration, healthy fats, steady energy, and micronutrients from real food. You don't need to oversupplement. You need to eat smarter. Wake-up call for seniors. If you're over 60, every choice matters more. Your body doesn't process supplements like it did at 30. Even good intentions, like taking vitamins, can quietly backfire. That's why I made this video. Not to scare you, but to inform you. Because awareness is your most powerful medicine. So here's what I want you to do. Check your supplements. Read every label. Know your dosages. Ask your doctor. And most importantly, listen to your body, especially when it whispers. If anything in this video made you stop and think, let me know in the comments. What's one change you'll make starting tomorrow? And if you found this helpful, please give it a like so others can find it too. This is Dr. Friend for Feel Fresh 360, reminding you, you're never too old to protect your brain, and it's never too late to take back control of your health. Subscribe, stay informed, and stay strong. We're in this together.